Have you ever had that sinking feeling when a patient says, "I'll think about it"? And that's after you've just spent more than 20 minutes explaining the urgency of having an acute periapical lesion treated. Or maybe you notice someone nodding politely while their eyes are telling you that they haven't understood a word. Well, you're not alone. Most of us in dentistry were trained with a strong focus on clinical skills and very little focus on developing communication skills. In fact, the average dental professional gets less than a day's worth of formal communication training. And that while we spend most of our time communicating with patients and members of the dental team. So today I'm going to share something that transformed my practice and could do the same for yours. A complete communication mastery system. We designed it specifically for dental professionals. And here's what makes this different. I'm not just going to give you theory. By the end of this video, you'll have a practical framework that you can implement immediately. The aim of this video is to give the tools so that you can improve how you connect with patients, how you explain complex concepts, and how to build trust beyond your clinical findings. In fact, I'm so confident in this system that I have prepared 3 practical resources to help you implement what you learn at different points in this video. I'll tell you how you can get your hands on these absolutely free. So whether you're struggling to get patients to accept treatment plans, or you're finding it difficult to deal with anxious patients, or maybe you simply want to create more meaningful connections with patients, well, we're going to discuss all of the above in this video. So let's dive in. So before we get into the how, let's talk about why mastering communication is perhaps the most valuable skill you can develop as a dental professional. One large study in the BDJ found that 87% of complaints against dentists had nothing to do with clinical mistakes. They were due to communication breakdowns. Just think about what I just said. Nearly 9 out of 10 problems could potentially be avoided with better communication. But avoiding complaints really isn't just the only thing here. When we communicate effectively, our treatment acceptance rates will increase by up to 30%. And that is patients saying yes to care they actually need. We also see a significant drop in patient anxiety. And that makes appointments just that bit more pleasant for everyone. Your referrals increase because patients who feel heard and understood become your best advocates. They start referring other patients. So you'll see more word-of-mouth marketing happen. Clinical outcomes improve because patients follow your recommendations more consistently. And finally, team satisfaction increases because you're reducing the risk of misunderstandings. And after implementing the system I'm about to share with you, we saw at my dental group an increase of over 20% in treatment acceptance. We also started receiving reviews that specifically mentioned how well we explained treatments and how comfortable patients felt asking questions. Now, the bottom line is this: you can be the most skilled clinician in the world, but if you can't effectively communicate that skill to your patient, much of your expertise goes to waste. But here's the good news. Where some clinical skills may take a decade of sharpening before you reach expert level, improvements in communication can happen immediately if you follow the right approach. Now, before we dive into the solution, let's identify the 5 most common communication pitfalls I have witnessed in my 23 years of working alongside over 400 clinicians. The first one is the technical overwhelm. So this is one of the most common and invisible barriers to patient understanding and trust. As clinicians, we're fluent in dental language, we treat interproximal caries, we restore with a Class 2 composite, or we spot a periapical radiolucency. This terminology is effortless for us, right? It's like second nature. But to patients, it's like being dropped in a conversation in a foreign language, a language they don't speak. Let's take a simple example. A dentist might say, you have interproximal caries that requires a Class 2 composite restoration. Well, to the patient, this very much sounds like something's wrong with something and it's going to cost me. Now imagine saying this. You have a small area of decay between 2 teeth. It's not visible, but we can see it on the X-ray. We can clean the decay and rebuild the shape of the tooth with a white filling. The difference is that the second statement is clear, it's visual, and it speaks to the reality the patient lives in, not our reality of dental professionals. So the technical overwhelm doesn't just confuse people, it creates doubt. Patients start to hesitate, and it definitely isn't beneficial if you want to create a doctor-patient relationship that is built on trust. When patients don't understand what you're saying, They can't make confident decisions. And they're far more likely to say, I'll think about it, even when the treatment is completely appropriate. Clinicians who have great communication skills know that if a patient feels unintelligent, they won't ask for clarification. They'll just say no. It's not about dumbing things down. It's about lifting our language up to the level of empathy and clarity and connection. Next is the assumption gap. One of the most common traps in clinical communication is assuming that once we've explained something, the patient has fully understood it. There's a common misconception in communication that if I say something and you can hear me, that you must understand what I've said. This view assumes communication is linear. I speak, you receive, and understanding naturally follows. But in reality, human communication is far more layered. It's nuanced, it's much more fragile. So just because something is audible doesn't mean it's been absorbed. Just because someone nods, that doesn't mean they grasp it. And just because we've explained something very well from our perspective, that doesn't mean it made any sense from the patient's perspective. So there are 5 filters every message has to pass through before understanding occurs. The first filter is the language layer. Are we using terminology they actually understand? We already mentioned that dental professionals often use technical language most patients don't speak. Translating our jargon into plain human language is a prerequisite when interacting with patients. The second filter is the emotional layer. Is the patient in a state to receive information? If someone is anxious, embarrassed, or distracted, their brain is focused on safety, not on processing details about a crown or Invisalign or dental implant, no matter how clearly we explain something. If their emotional state isn't calm and open, the message just won't arrive. The third filter is the relevance layer. Does the explanation answer the question they have, even if it's unspoken? We might talk about decay and fillings, while the patient is quietly wondering, like, will this hurt? Or can I afford this treatment? So if our explanation doesn't speak to what matters to them, they just won't retain it. Now the fourth filter is the bias layer. Every patient comes with a history of experiences, good, bad, and in many cases even traumatic. If they've had a dentist they couldn't trust in the past, they may listen to you with suspicion. It has nothing to do with you, but you are part of their experience, whether you like it or not. So now you can decide what kind of experience do you want to add to the patient's library of experiences. The fifth filter is the retention layer. Even if someone understands us in the moment, that doesn't mean they'll remember it later. Mainly if we drown them with information, without visualization and without structure. We must cut our communication into small categorized pieces that can be consumed by the patient, slowly and fully. In order to do that, we can summarize key points, we can present these key points in a bullet point structure, and then also provide written and visual support to reinforce what you just said. So that means real effective communication is not just about speaking clearly. It's about making sure the patient understands what we're saying. It's about establishing an emotional bridge. And it's about checking that what we said is what in fact they heard. So instead of asking ourselves, did I explain that well? Now you can ask a much better question. Did they actually understand what matters most? Because at the end of the day, communication isn't complete when a message is delivered. It's complete when that message is understood, felt, and remembered. We walk them through the diagnosis, show them the radiographs, we describe the procedure, and then assume that all of this means they're now fully informed and ready to decide. Now in your mind, you've clearly explained the urgency, but if the patient quietly nods, says, okay, I'll think about it, and leaves, it might not be because they disagree. It's often because they didn't fully grasp the consequences of delaying or the benefits of acting now. And that is the assumption gap. And here's the key. Patients rarely tell you when they're confused or overwhelmed. They'll smile politely, say they'll be in touch, and then disappear. So how do you close that gap? Well, you check for understanding, gently and without pressure. So you can say things like, is that making sense so far? Or you can say, do you want me to break that down a bit more? Or you could also say, how do you feel about what we've just discussed? By bringing the patient into the conversation, rather than assuming they're already following, you give them that space to ask, to reflect, and to maybe really start taking things in. Because let's be honest, just saying something is not the finish line. Real communication only happens when they get it. when it clicks, when they nod, not out of politeness, but because it truly makes sense to them. So the third common pitfall is the empathy bypass. This is one of the most subtle and costly communication pitfalls in dentistry. It happens when we become so focused on delivering clinical information, treatment options, and technical details that we completely bypass the emotional reality of the patient sitting in front of us. So we talk about decay, and we talk about bone levels and crown margins and root fillings, but we then forget that patients also bring fears, doubts, and often also long emotional history with dentistry. They might be anxious because of a bad childhood experience. Maybe they're embarrassed by the state of their teeth. Maybe they're worried about money. Or maybe they're just overwhelmed by the whole experience. And when we don't pay attention to all of that, the result will be that they don't feel safe. They feel unseen, they feel unheard. So here's an example. Let's say that you tell a patient that you'll need to carry out a root canal treatment on a lower molar and then place 2 crowns on the molar and the neighboring premolar. That will preserve the teeth and prevent future infection or fractures. So this is a clear message, it's accurate, and it's logical, right? It all makes sense from a clinical perspective. But the patient is sitting there thinking, will this hurt? How much will this cost me? And why did this happen? And am I going to lose all my teeth? And am I being judged? Is he judging me? In your message, none of that has been addressed. So even if you've done a brilliant job clinically, the patient could walk away feeling uneasy. And often they won't even be able to explain why. That is the empathy bypass. So how do we avoid it? Well, we slow down. We ask simple human questions like, how are you feeling about all this? Or, is there anything you're worried about? Or we can ask, has anything like this happened before? Just a few seconds of emotional acknowledgement can change the entire tone of the appointment. You could also say, I see that you're not comfortable with what I'm saying. I'm really sorry to have to bring you this bad news. I wish I could give you better news. This shows the patient that your recommendation is based on sound clinical judgment and cannot be changed. But at the same time, it reassures them that their emotional response is valid and that you're not ignoring how difficult the news might feel. We need to bring across that we empathize with the patient, because before we can treat the teeth, we must reach the person behind them. The fourth common pitfall is the one-size-fits-all approach. And from my experience in this field, this is a silent blocker in many dental consultations. And in fact, it's so easy to miss. So this pitfall happens when we use the same communication style with every single patient, without adjusting for who's actually in front of us. We assume that just because we prefer things in a certain way, detailed, efficient, maybe a bit technical, then everyone else must want the same, right? Well, that's incorrect. People are different. They walk into your surgery with different personalities, different learning styles, different emotional needs, and communication preferences. Some want every detail before they decide, others want the bottom line. Some need time to process, others need reassurance first. And when we don't adapt, we lose them. Not because we weren't competent, but because we didn't connect in the way they needed. Imagine you explain a root canal procedure in full, step by step. Endo access, file systems, irrigation, obturation, everything. Clinically, it's perfect. But the patient looks at you and says, I think I need to think about this. What this patient is telling you is that they didn't need the mechanics. They needed a message that tells them this will stop the pain, save the tooth, and help you avoid an extraction. Now, a different person with different needs, one who wants the detail, maybe this patient feels anxious if they don't understand what's happening. And if you start rushing or if you oversimplify, they interpret that as you hiding something. That's why communication can't be a one-size-fits-all. So what's the alternative? Well, we calibrate. We watch body language, we listen for cues, we ask early on, would you like the full breakdown or just a simple summary? Or do you prefer seeing pictures or just a straightforward explanation? These small shifts can radically improve patient understanding, trust, and treatment acceptance. Because when you meet people where they are, they're far more likely to go where you're guiding them. The final common pitfall is the rush factor. If you're working in a busy clinic, time often feels tight. There's pressure on you to stick to your schedule. You have procedures to complete, notes to write, and the next patient is already waiting. And that's exactly how the rush factor creeps in. It's like when we start treating communication like a checklist. As in, explain the diagnosis, present the options, mention the fees, and then move straight to consent and treatment. But here's the issue with this approach. we end up rushing through the part of the appointment that often matters most for the patient. For the patient, it's probably the only chance to pause, to reflect, and to put to us any questions or concerns they may have. So what tends to happen is that without that breathing space, the conversation becomes one-sided. You're talking to them, not with them. There's no dialogue. See, patients can sense it. Let me give you an example. Imagine you finish explaining a treatment plan and say, "Any questions?" There's a brief pause, they shake their head, you move on. But deep inside, they do have questions. They just didn't feel like there was room to ask. Maybe you were standing up. Maybe your tone was rushed. Maybe they sensed you were already behind schedule. And this is exactly how doubt is formed. Not because they didn't trust the diagnosis, but because they didn't feel invited to discuss it in depth with you. You being the person who will most likely be carrying out this very invasive treatment. And once they leave without clarity, it's so much harder to rebuild that trust. So how can you avoid the rush factor? Well, you can start by building in micro pauses. There's no harm in a bit of silence after a sentence to allow the treatment proposal or diagnostic analysis to sink in. Give it time to be fully understood. You can then normalize questions. You could say things like, "So that was a lot of information. Take a second and let me know what's coming to mind." Or you could say, "I want to make sure that made sense. What stood out to you most?" Or you could say, "Don't worry if you're unsure, we can go over it together." See, these things are not time wasters. They're ways to build trust, to connect at the most basic human level. And when you connect at that level, amazing things happen. Patients feel that connection and they feel the human behind you as a doctor. Because sometimes the most powerful part of a consultation isn't really what you say. It's the space you give for the patient to speak. Now, if you've caught yourself doing any of these pitfalls, don't worry. Really, we all have. The key is in recognizing these patterns and then having a framework to overcome them. Well, let's talk about a framework that helps. If you would like to receive a comprehensive self-assessment tool to identify your specific communication strengths and areas for improvement, comment "Reach Framework" below and I will send you my 20-point communication self-assessment tool absolutely free. It's a practical resource that will help you apply exactly what we discussed today. Now let's move on to the solution. After more than 2 decades of studying communication in dental settings and testing different approaches, I've developed a framework that consistently produces remarkable results. I call it the REACH framework. So let's break down each one of the 5 elements. First up is resonance, and it's all about creating emotional connection. It's about establishing a genuine connection in those crucial first moments with a patient. It's the foundation for everything that follows. So in practice, this means matching your energy level to the patients when you first greet them, using appropriate eye contact and open body language, finding authentic points of connection, using the patient's name naturally in conversation, and being fully present. So the key is authenticity. Patients can sense when you're using techniques versus when you're genuinely connecting. Next is empathy, truly understanding and validating the patient's perspective and experience. It goes beyond sympathy. So let's discuss tactical ways to demonstrate empathy. First, you can use reflective listening. You could say, "What I'm hearing is..." You can also acknowledge emotions by saying, "That sounds frustrating or concerning or exciting." You can ask questions that explore the patient's perspective, or you could validate concerns without immediately trying to solve them. And finally, you can recognize nonverbal cues that signal anxiety or confusion. The third pillar is articulacy, and it's about explaining complex concepts simply. This is where many dental professionals struggle. We understand complex dental concepts so well that we forget how foreign they seem to patients. The key elements of articulacy are using everyday language instead of dental jargon, employing metaphors and analogies that relate to common experiences, following the rule of 3, limiting explanations to just 3 key points, using visual aids to visualize what is often invisible to patients, and checking understanding by asking patients to explain concepts back to you. One of my favorite techniques is the explain it to a 10-year-old approach. If you can explain a complex procedure in terms a child could understand, well, that's articulacy. For example, here's how you might describe a composite filling. We use a soft material, a bit like clay or like Play-Doh, to gently shape and rebuild the tooth. Then we shine a blue light on it to make it hard and strong, just like a real tooth again. If you would like to receive my complete guide to adapting your communication style to different patient types, comment communication style below, and I will send you my patient communication style guide. It includes specific strategies for analytical patients, emotional patients, decisive patients, and relationship-focused patients. So you're a dentist who's passionate about what you do, but honestly, you're feeling a bit stuck. Working harder, but your income feels stagnant. Dreaming of more freedom, more fulfillment, maybe even that 15K or 20K monthly income you know is possible. Now here's the thing, you've probably tried the usual advice, right? Just see more patients, work longer hours, cut costs. But that just leads to burnout, not breakthrough. See, what most dentists don't realize is that true success, both financial freedom and fulfillment, requires a completely different approach. So that's exactly what I've created. The Essential Dentist's Guide, a completely free 5-step course that'll show you the real pathway to becoming fulfilled and financially free. We're talking about understanding your numbers properly, strategic action, smart goal setting, effective communication, and building your personalized roadmap. Now, this isn't just theory. This is the exact foundation that leads to the over 30K monthly income many of my dentists are now achieving. 5 focused lessons, completely free, delivered straight to your inbox. No fluff, just proven strategies that actually work in the real world. Alright, so if you're ready to stop spinning your wheels and start building the practice you actually love, check out the link in the description below to get your free access. Your future, fulfilled and financially free self will thank you. The 4th pillar is consistency, which is about maintaining clear messaging. See, consistency builds trust. It also reduces the risk of confusing patients. Now, this applies both to you and your team. So what does this mean in practice? It means ensuring all team members use consistent language when explaining common procedures. It also means creating standard explanations for your most common treatments, or making sure your written materials match your verbal explanations. It means following through on communication promises. When you say, I'll call you tomorrow with that information, you call tomorrow with that information. And lastly, it means regularly reviewing and updating your communication approaches as a team. So you could consider creating a communication playbook, a shared reference of clear, patient-friendly metaphors and explanations and phrases for your most common procedures. This kind of resource helps ensure that every member of the team explains things consistently and accessibly, reducing confusion and improving trust. Practices that implement tools like this often see fewer follow-up questions from patients and a significant increase in treatment acceptance. Now, the 5th and final pillar of the REACH framework is honesty, and it's about building trust through transparency. The final element of the REACH framework is perhaps the most important. Without honesty, all other communication efforts fall flat. Now, before I discuss the practical applications, it's important to note that honesty stems from an internal conviction that throughout life, as a person, honesty should be our guiding principle. Not just in dentistry, but in every human interaction. It's not a tactic, it's a mindset. Honesty should be woven into the way we think, we speak, and lead, especially when the truth feels inconvenient. It's the quiet confidence to say, this may not be what you hope to hear, but it's what you deserve to know. Patients can sense when something is being softened, rushed past, or withheld, and while they may not always understand the clinical details, they always understand the tone of your integrity. See, honesty builds long-term trust, even if it means short-term discomfort. It tells the patient, you're not just a treatment, you're a person I respect. So now, practical applications may include discussing treatment limitations and potential complications openly, presenting all reasonable treatment alternatives, even when they might be provided elsewhere, being transparent about costs and financial aspects, admitting when you don't know something and following up later. It includes avoiding overpromising results and balancing optimism with clarity about challenges and healing times. If you say to the patient that this treatment won't hurt at all, you better know for sure that your local anesthetic is working 100%. Otherwise, you will erode trust unintentionally. A more effective approach is to set honest expectations, such as you might feel some pressure. And if you feel any discomfort, raise your hand or make a noise and I'll top up the anesthetic. See, this kind of transparency helps patients feel safer and more in control, especially those who are anxious. Remember, patients don't expect perfection. They expect honesty. So now that we've covered the REACH framework, let's talk about how to implement it in your daily practice. So first, you can start with self-assessment. Begin by identifying your natural communication strengths and areas for improvement. You can also use the communication self-assessment tool I mentioned earlier. Second is focus on one element at a time. Don't try to transform everything at once. Choose one element of the REACH framework to focus on each week. For example, spend 1 week really honing your empathy skills and developing a sense of connection with the emotional well-being of your patients before moving on to articulacy. Third, create practice-specific resources. Develop resources tailored to your specific practice. This could be a list of common dental terms with plain English language, or a collection of effective metaphors for explaining complex procedures, or a set of questions to help identify patient communication preferences. Now, fourth, you need to implement team training. See, communication excellence requires a team approach. Schedule regular training sessions where team members can role-play challenging communication scenarios or share successful approaches, or provide feedback to each other. Or once you've done all that, you may want to develop consistent messaging. And the fifth way to implement REACH is to gather patient feedback. Create a simple feedback mechanism specifically about communication effectiveness. Questions may include, how clearly did we explain your treatment options? Or, did you feel your concerns were understood? Was there anything about your treatment that surprised you or that you wish you had known beforehand? If you would find it helpful to have a free 30-day program of simple, practical exercises to strengthen your communication skills, just comment REACH Mastery below, and I will send over my Communication Excellence Daily Exercises Guide. It includes short, 5-minute tasks you can build into your day to gradually improve how you connect with patients. Now, one of the most powerful aspects of the REACH framework is its flexibility. Different patients have different communication needs, and recognizing these differences can dramatically improve your effectiveness. So let's look at 4 common patient types and how to adapt your approach. You see, not every patient walks in with the same mindset. Some need data, some need connection, some want speed, and others just want to feel safe. Understanding who's in front of you and adjusting how you speak can make all the difference. So let's start with the analytical patient. These are the ones who've read 3 articles before their appointment. They come in with a list of questions and take notes while you're speaking. They value precision, data, and logic. They don't expect anything that sounds unfounded or speculative. So with them, lean into specifics. You can offer percentages, success rates, explain the biological why behind what you're doing, and if you can, give them something in writing. The more informed they feel, the more they'll trust you. Then there's the emotional patient. These patients lead with feeling. They might open up about their anxiety or past dental experiences, and they really respond to human connection. For them, personal examples and relatable comparisons make all the difference. Help them picture how the treatment will impact their daily life, not just their mouth. And always validate their emotions before diving into clinical details. So this type of patient needs to feel seen and heard before they can process information. Then there's the driver, or the decisive patient. And they're very different. These are your high-energy, results-focused individuals. They want to know the outcome, how long will the treatment take from start to finish, and what the next step is. And all of this in under 1 minute. So with this type of patient, keep it brief, focused, don't over-explain, respect their time, be direct, and give them a clear recommendation. They'll appreciate the clarity and efficiency. And finally, there's the amiable patient, the relationship builder. These patients value connection above all else. They'll often ask how you are, talk about their family, and want to feel like they're in safe hands. With them, it's about trust. Now you can use words like we instead of you. You slow down the pace, and you make sure you create a setting where they feel supported and part of the decision making. The clinical part is still very important, but it's secondary to the relationship. Now, of course, no one fits perfectly into just one category, but simply being more aware of these patterns can help you notice what really matters and have conversations that genuinely resonate. The key is to get a sense of which type of patient you're working with and then adapt your approach accordingly. This doesn't mean being inauthentic. It means creating a communication environment where patients can receive information and care in a way that works best for them. So finally, let's talk about how to actually bring the REACH framework into your daily routine. Because as I said, this is not just theory. It's something you can begin using straight away. One simple approach is to start your day with a quick team huddle, where you pick just one element of REACH to focus on. Say, for example, articulacy. You might all agree to make a conscious effort that day to explain things in simpler, more relatable language. You'll be surprised how much clarity that brings, even with the most routine conversations. Or you could decide to introduce what I like to call communication rounds, much like clinical observations. So this is about learning from each other. One of your team members might observe a consultation with permission, of course, and offer some constructive feedback afterwards. It's a gentle, respectful way of sharpening our communication awareness as a team. It's also a great example of how shared learning of what some may call cross-pollination of knowledge helps dental practices grow together as a team and raise the overall standard. Then there is personal reflection. Take just 5 minutes at the end of every day, maybe after you've written up your notes, and think, what went really well in my conversations today? Where did I feel the patient really understood me? Was there a moment I could have explained things a bit better? If you're in a practice with other clinicians, try arranging a few informal sit-in or shadowing sessions with colleagues who have communication styles you find effective. You can learn so much just by observing how someone else connects. And finally, consider working on a few scripts for those conversations we all tend to find a bit tricky. Not to sound rehearsed, but to prepare. So it might be explaining why NHS options are not suitable or available for a patient, or how to talk about fees with someone who's cost conscious, or what to say when something hasn't gone fully according to your original plan clinically. Having a few of those phrases worked out ahead of time can really help you in the moment. And just to be clear, this isn't about becoming robotic or rehearsed. Real and genuine communication mastery is about awareness. It's about becoming more flexible, more present, and more human in the way we speak and listen. And over time, these skills become part of who you are, not something you have to think about all the time. So we've covered a lot of ground today, from understanding why communication matters in dentistry to exploring the REACH framework and how to implement it in your daily practice. Let's recap the key points. Effective communication is the most valuable non-clinical skill you can develop as a dental professional. The REACH framework provides a comprehensive approach to dental communication. It's about resonance, empathy, articulacy, consistency, and honesty. We also discussed adapting your communication style to different patient types and how this can dramatically increase your effectiveness. And finally, we discussed that implementation requires consistent practice and team alignment. See, the journey to communication mastery is an ongoing effort. It never really stops, but even small improvements can yield remarkable results. In my own practice, implementing these principles led to an increase in treatment acceptance, a significant reduction in patient anxiety, and a more satisfying work environment for the team I work with. I encourage you to start with just one element of the REACH framework this week. Just notice the difference it makes in your patient interactions and then build from there. And remember, I've created 3 practical resources to help you implement what you have learned. For a complete self-assessment of your communication skills, comment REACH framework below. For strategies to adapt your communication to different patient types, comment communication styles. For a 30-day program of practical communication exercises, comment REACH mastery. I will send you these resources to help you on your journey to master the full scope of communication in a dental setting. Thank you for taking the time to watch this video, and I hope that the information presented was valuable to you. Your patients may never know the effort you've put into communicating more effectively, but they will feel the difference. They will feel it in their understanding, their trust, and ultimately in the care they receive from you and your team. Thank you for watching.